The major trend which I have seen in the healthcare industry is that it is becoming more focused on the patient instead of focusing on the environment of the industry. Previously, it is either the hospitals or the providers and the payers, and the patients never knew what's happening with them. So it is all the applications and the tools which are existing in the industry today are more focusing towards the patient and saying how do we serve them better, how do we make sure that they're satisfied, how do we make sure that they're able to collect the data which they provide to the providers. In the last 10 years, there used to be a lot of kiosks which were very common in the hospitals or at the physician offices. Now it is taking over by the mobile devices, because if you see the innovation which has happened in the industry is that we have iPhones, Blackberries, iPads, and the devices which are being the common use by a common person, and they are the patients. Now these devices are very slick, so you can make a slick standees and put iPads on it too, and you can have multiple iPads which are used as kiosk in the hospitals. We at NIIT had built an application which we call it as MASH, which is being used in the hospitals today. Now what we have seen is that there are different kind of demographics which are using these devices. It was very interesting. The first person who actually checked into Antelope Hospital was a 73-year-old person, and we thought it's going to be tough for him to really check in, but it was very interesting. He got very excited with it, and without any help he's able to check in the hospital without any issues, with no errors on the device. And he was pretty happy, and his form filling on saying that it was a great experience which he had with the iPad. When you go 2-3 years down the line, the devices is going to be such that you are able to communicate with the physicians or the doctors or the hospitals, and you may have even you can have the pictures seeing each other, and you are getting the consultation sitting at home. So there will be a lot of things which can happen, and which can actually save a lot of trips to the hospitals, or which can save a lot of trips to the physicians. So I can see going forward in the next few years, you may have lesser trips to the hospital, and most of the things and the consultation is done on these devices, through these devices, either via video or via phone. I mean, why should I be visiting a doctor if I have a small pain? Which is not happening today. So I feel that these devices are going to change the way the healthcare is done and delivered today. We are all slaves of a lot of systems. So if we could make one integrated system which can help the whole healthcare, that would be the great thing. And the other interesting conversation was the patients still don't know how the money is paid to the provider and who pays it, and how do I get my bills at home, which I don't understand. So I think we have to move, and we're going to go to the next level, where I think the patient will have all the information about his health, about the money which he has paid, and how this whole thing is floating around, and that can only happen if there is an integrated system.